Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, April 20th. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. I'll be leading the discussion today. I'm Meg Kennedy, Communications Program Coordinator with the Institute. So Dr. Murphy, good morning, afternoon, and I'd like to start with
Good morning, Meg.
Updated COVID statistics. So as of today, the United States, there is a 14,449 average new cases per day, approximately 190 COVID deaths per day, a 17% new booster proportion, and those are updated US stats. So Dr. Murphy, we've had a lot of questions about the second new booster. Could you tell us a little bit about that?
Yeah, first of all, I want to formally introduce Meg here, who has taken over from Sophie Bukowski, who's gone on in her career. So welcome, Meg. I look forward to working with you on this webinar, not a webinar, but our video every week. So we're going back to the weekly schedule. And we have been getting a lot of questions about the second new booster that the FDA just recently approved. And between the CDC and the FDA, they're working out the guidelines for who should really take it. So what we're talking about is the new bivalent booster, the one that came out on August 31st, 2022. People started taking it in September. If you took your vaccine in September or later, September 2022, you got the new one, okay? The old one was retired. The new one is half based on Omicron and half on the original Wuhan virus. So if you've had that new booster, which as Meg just said, only 17% of people have taken that, you've got the new one, and it is new and it is improved and it's better. And every statistic you look at, people do better if they've taken that new booster. So even if you're up to date on the old booster shots, you should take the new one because you will do better. It's geared more for the virus that's circulating now. So anyhow, so what did they approve? They approved a second one. Most likely what's going to happen with COVID vaccinations is every once in a while, the virus is going to be tweaked, like this new bivalent one. There'll be another one at some particular point as the virus continues to evolve. And most likely, it's going to be something akin to an annual shot, similar to what happens with the flu. The difference between the flu, though, and COVID is not seasonal. I don't know if you remember back, but we had the big Delta outbreak in August of 2021. So we can get an outbreak of COVID at any particular time. Remember, COVID is a coronavirus, and the coronavirus is family members of coronavirus cause the common cold, and people get summer colds all the time. So it's the same thing with this. It's not as seasonal. Influenza is very seasonal. It's really only occurring about 6 months of the year in the late fall, early winter, and very early spring. But anyway, so back to the new, it's not the new vaccine, but it's the second shot. It's a second booster shot of the newer vaccine, the bivalent vaccine. And so what the recommendation is those 65 and older can get a second updated version of the Moderna or the Pfizer vaccine, but they should not take it if it's within 4 months of the last one. Matter of fact, they can wait if they want. They can wait until the end of the summer. There's no real rush if they've already had that first bivalent booster. So at least 4 months. And what that does is it limits the number of side effects, which are mild anyway, but you tend to have less side effects if you wait a little bit longer. Now, if you, they also are allowing a second booster to be given to people who are immunocompromised. So if you have some underlying medical condition that affects your immune system, you too can get a second booster shot. So now, if you've never had the bivalent booster, if you haven't had a booster shot since September of 2022, you should get it now, because you will get even more protection. So that's really the story about the boosters. They've tried to make it more simple. It sounds complicated, but it's really not. 65 and older, though, is the group they're targeting, and anybody with an immunocompromised disease. And if you have a question whether you're immunocompromised, there's a whole list of problems, medical problems like diabetes, being overweight, underlying cancers, and et cetera. They're all listed on websites, or you can just ask your doctor, am I immunocompromised? Is my disease considered an immunocompromised disease? Almost every disease is, so it's pretty easy. So you want to err on the side that gets you immunized with these vaccines.
That's fantastic. Thank you so much, Dr. Murphy. I look forward to sharing all of this information with my parents.
Yep.
Can you tell us a little bit about the new variant?
Yeah.
Because that's been in the news a lot.
Yeah, it's been in the news a lot. And so, COVID is not over. Even though our death rate has gone below 200 for the first time in a long time, which is a really great sign. There are variants. If there's anything circulating in the world, it is going to mutate. So there's a new variant. It's called Arcturus or XBB.1.16. And that was first noted in the Indian subcontinent, but has now spread to over 20 countries, including the United States. It accounts for some 7% of the isolates found in the United States right now. It is easier to transmit. That's why it's taking over. The WHO has called it a variant under monitoring, which is not like a super warning, but they're watching it more closely to see if it behaves any difference. For a variant to take over, it has to be more transmissible. So we already have the most transmissible disease known to man, and now we got something even more transmissible. So far, it doesn't look like it's that much more severe. One issue is it may be causing irritation in the eyes. Itchy eyes seem to be a common complaint with this. But other than that, it's behaving the same overall protection from the vaccines and from the treatment like Paxlovid. In case you do get sick, people that are eligible, all the eligible people for the second booster dose are also eligible for Paxlovid. Actually, Paxlovid is eligible for people over 50. But Paxlovid works whether you got vaccinated or not. And remember, the best immunity anybody has is if you got the vaccine, got the new booster, and you also had COVID. If you have all those three things, you do the best of anybody. You have fewer hospitalizations and survival is much better. So just keep that in mind. And that's the news on the new variant. So, we'll see what happens with that and what the next variant will be.
Right. And if people do have the itchy eye, if they do find that they have itchy eyes, do you have any recommendations for what they should do?
If the new variant or the eye
Yes.
problem, it'll resolve like everything else.
Perfect.
Yeah, it doesn't. There's nothing special that has to be done with that.
Right.
It's probably contagious with the eye, though. So be careful. As any eye infection usually are contagious.
Right. Thank you. So I've seen long COVID in the news a lot. Can you talk a little bit about long COVID, maybe the symptoms?
Yeah.
Is anything new to share
long
on
COVID didn't go away. Now, long COVID is less in people who took the vaccine. So that's one good thing, but they can still get long COVID. Now, it's 3 years after the start of the epidemic. The reports are at least 16 million and maybe more have long COVID. And it's estimated that about 4 million people, that's over 1% of the whole US population, say long COVID has significantly reduced their ability to carry out day-to-day activities, including working effectively at their jobs. So we have a long COVID clinic here at Northwestern run by Igor Koralnik and his team, who includes Gina Perez Geraldo, who we've interviewed on our podcast report. And they just published in the Annals of Neurology a very nice report on the first 600 cases of people who had long COVID and neurologic problems, if they were hospitalized or not hospitalized. And they found that a couple really kind of striking things, that they found that at least 1 million people are still out of work, and that long COVID now is the leading neurologic condition in the United States. So this basically came out of nowhere. And so what are people complaining of that's keeping them from work? The main neurologic symptom that's debilitating is brain fog. They just, it's just a cloudiness. They're just not thinking clearly, but also headache and dizziness and fatigue and an overall impaired quality of life. So, you know, they have the fatigue and they're not sleeping right, and anxiety and depression and whatever. The ones that end up hospitalized, they tend to be a little bit older and having underlying comorbidities. Also, women tend to get it more often than men, but anybody can get it. It's a big problem. And the treatment is basically treating the specific symptom, if there is a treatment, and just giving it some time. People do tend to get better with time, but not everybody. And how much time? I mean, we're only 3 years into this. You know, is this going to go on for another year with these symptoms, or is it even going to be longer, or is it permanent? We don't know. Most people do get better though. So, you know, it's something that there's a lot of attention being paid to it at this particular time. And it's really worthy of study because so many people are impacted by long COVID, especially these neurologic complications.
Thank you so much, Dr. Murphy. These are fantastic. If you have anything else you'd like to bring up?
What we'll be doing is, if anyone has any questions, they can put them on the Facebook page. We will be responding to questions again, like we did before. And we're going to be highlighting, you know, bigger, probably 3 or 4 kind of news notes that come out every week. We also may touch on some other important infections that come along, whether they're related to COVID or not. And so we look forward to continuing with this weekly question and answer and issue reporting. And so, Meg, welcome, and thanks. Thank you for being a great host and producer. And we'll see you again next week. We'll see everybody again next week.
Thank you so much, Dr. Murphy. We'll see everyone next week. Take care.